This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 47 of a 58-part video series. Please review our introductory video for background information. Part 47 goes into the subject heading of medications. There are various forms of pharmaceuticals, recreational drugs, all types of medicines, and even pharmacists have a hard time keeping them straight. One of those obvious drugs to avoid are recreational drugs. A person who consumes heroin, cocaine, or any other mood-altering substance cannot survive with heart failure. It simply puts too much stress on the cardiovascular system, and you don't have any extra strength to spread around at that. Now, to legal medicines, medications prescribed by doctors, some of them can cause heart failure. If you listen to the disclaimers on television, you will hear a rapid-fire shotgun of potential side effects to every medications. Listen closely. Some of them will say causes new or worsening cases of heart failure, and the FDA approved it. So every medication that you are taking, carefully check the complete side effects list available from your pharmacist for any medications you're taking. Obtain a physician's desk reference called the PDR from your local library. If it's in the reference section, take a list of your medications to the library and read every single thing it says. You are responsible for what you take and how much. And even though your doctor may have prescribed them, he may have not taken into account your personal history or the potential side effects that could be fatal. So know what you're taking and why. Keep doses to a minimum effective level. You may have to question your doctor to find out the basis for his prescription. Many doctors are surprised to see that you are so well informed. The best doctors will work with you and be happy that you're interested. The worst doctors will belittle you and try to get you not to look into their choices. Keep in mind, doctors do in general have an interest in keeping you around for a long time as a customer. They want you until the day they retire. So take charge of your treatment and keep a journal on file for every medication you take with the results. If it's not too much trouble to have life itself for a long future ahead. Now, in my personal case, I still take 2 medications. I did tell the doctor years ago that I had to stop taking the blood thinner warfarin because I noticed in my blood work annually that some parameters were going borderline, and I could see it was being caused by the warfarin dosage. In my particular case, warfarin or blood thinners is a standard form of treatment. However, there was no need because I have a CRT-D implanted that prevents atrial fibrillation, so there was no chance of blood clots being formed through recurrent AFib. So I told my doctor I needed to quit taking the warfarin. He did an EKG check to make certain I was stable, reviewed past history, and finally agreed. And over the following 2 years, my blood work returned to normal and is now extremely good, as well as someone who's 20 years of age. I still take an ACE inhibitor and carvedilol, a beta blocker, in very small dosages, extremely small. Because I've researched them, I've found that they are safe. And at this point, there are no side effects other than maybe a dry cough. In writing this book, I was able to update the intake of vitamin D to the latest standards on the clinical studies. And I found that that eliminated most of the dry cough that I used to suffer from the ACE inhibitor. So apparently that medication was causing vitamin D deficiency. These are the things you learn when you review every medicine that you take in the PDR. You will find there are small nuances that doctors forget, things that are caused in a secondary reaction. For example, there are many statin medications used that are supposed to prevent heart disease by lowering cholesterol. In fact, they only lower a certain lipoprotein. And in so doing, they destroy the CoQ10 in your heart that you need for the energy to pump your blood. So it's a black box warning label required by the Canadian government on every statin drug administered, because it's just like the smoking warning label by the U.S. Surgeon General. It could be fatal. Keep these things in mind with medications. Learn them all and learn what you're taking. Take your life in charge. I am J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available from Amazon in print and Kindle editions. It's available from the Apple iTunes Store in an iBooks edition and from eBay in a print edition. You may also order from the publisher, Wilkerson & Hughes, P.O. Box 777, Altoona, Florida 32702. Just send a check of $24 for the book with shipping. Thank you for listening.